Hi, Dr. Pelto here. I want to go over a little bit all about bunions here. This was a recent presentation that we did in the office. So we're going to go through a few aspects here. We're going to talk about, first of all, what causes bunions. Okay, so let's look here at this first picture here. What you can see here is a picture of toe length and the growth of the foot. So as a child is younger, here you can see a picture of an 11-year-old child. They actually have the beginnings of a foot that could develop into a bunion. And here what you can see on the other side is this is a 17-year-old foot, how this foot very much splays out, but because this child wore normal shoes, did not develop a bunion. So basically this is a bunion-prone foot, but if you wear minimalist shoes or natural shoe gear, it won't cause any problems. You can see another example of a mother with the same foot. This is the mother's foot, and this is the child's foot right here. It looks like the same foot of this mother, but what happened to this mother here is that she wore shoes and she actually ended up having a bunionectomy, and this is just an example of a shoe. And you can see how the shoe would push over the toe and over time cause the bunion. So a lot of the cause is how your foot is squished into a shoe and how your body moves over the foot. An example of a bunionectomy. It helped a little bit, but you can still see it would be better not to have to do that bunionectomy. Let's go now and look at the next picture here. This is an example of a shoe, 2 feet that look the same without shoes on, and then with shoes on. You can see everything is kind of pushed over. Long-term use of shoes is a big culprit for causing bunions. The next thing we want to look at are really just shoe choices, and this is just an example here you can see of the same patient. You can see these are the growth plates of the child. Here's the growth plates then as the bunion develops in this child, and then a surgical procedure to correct that. Sometimes this could be helped with shoes to influence that. Okay, let's go now and we're going to talk about shoe choice. Shoe choice is really important, and there are a few different types of shoes that can be more beneficial at preventing bunions. Sometimes it's genetic, but a lot of times it's due to shoes. So let's look at some of those to start out with. Here's a couple of examples. These are called minimalist shoes, and there's a test called the shoe liner test. Basically, you step on the shoe liner, and if your foot goes over the shoe liner, it's too narrow. Many people are in shoes that are too narrow. This is an example of an ultra shoe. This is a lem, or actually I think they're both lem shoes. Okay, what you can see here now is an example of different types of treatments. There's different pads that can be used, toe spacers. These are called correct toes. Many times these can be helpful for patients that have different types of foot problems. Okay, let's go on to the next one here. Orthotics can sometimes help to preclude a bunion from happening. This is called a Cluffy wedge. It kind of preloads the big toe joint to prevent any arthritis. Then you can also see there are different types of surgical procedures. We try to do everything we can to prevent them. This is a simple procedure with an enlarged bunion. It shifts it over. As they tend to get a little bit more advanced, you can see here, this would be the post-op type of an example before and after. This is another example of a patient with a bunion. These are the types of screws that are placed in there. And then what you can see here is the before and after. This is a joint that's quite bad that needs a fusion of this type of a bunion. You can't just fix the bunion because of the bad arthritis in there. What you can see here, here's an example of that fusion before and after and how the angle is reduced. Here's an example of a fusion from the top looking down, looking at the screws and the hardware that are in there. Next, there's another type of a bunion. If it's bigger, you can't just do it at the head, you have to do it at the base. This is a lapidus procedure of a fusion of this bone as well. This is what it looks like before and after. You can see the great reduction here in this bunion. This is a very difficult foot that the bone was up, everything very flat, arthritic type of a foot, and here you can see before and after. This patient also had metaductus, which is a very difficult condition, and all of this fusion in this area was necessary to straighten everything out. This is a very complex and long procedure, but it has a good outcome. The patient has a brand new foot, you can see here. We'll talk a little bit about recovery as well after this. In terms of recovery, after bunion surgery, you have to get the skin to heal. Basically, it takes about 6 to 8 weeks for the bone to heal. Depending on what type of procedure you have, you might be in a cast. You may have to do some non-weight bearing for a period of time. If you have one of those bigger procedures, you're going to have to be off at least 2 to 3 months. And then after, you need to work on range of motion, such as physical therapy, to get you back to full recovery. There were a few questions that were asked about this webinar here. I've had an injection in my bunion some time ago, but recently it's acting up. It's painful and sore. What would be my next option? Basically, if a cortisone doesn't work, you could try another injection. You could try an orthotic, a more anatomic shoe, or even surgery. Another question here, how does arthritis cause bunions, and what are the non-surgical treatments? We showed you a picture of an arthritic bunion, and it's the jamming of the joint can cause the arthritis. It can also be due to hallux limitus, and the surgical treatments are either fusion or cleaning out the joint or fixing the bunion. If there's a lot of arthritis, you really need to just fix the bunion. Next question, are there any downsides to a severe-looking but pain-free bunion? If it's severe, not painful, you don't have to treat it. If it acts up a few times a year with bad shoes, wear a brace, wear wider shoes, wear sandals. I don't recommend a non-painful bunion to have surgery because you can't make a non-painful bunion any better, right? Just be careful with the shoes. The next question, does Medicare routinely cover bunion surgery? Yes, they do. They might have an out-of-pocket deductible or something like that, but for the most part, Medicare covers it. Do toe spacers help at night? If you're going to wear a toe spacer like the correct toes, these are made to wear during the day, not usually at night. The night ones, it's not really long enough to correct anything. And the next question, what is the best way to avoid bunions? Shoe gear, shoe gear, shoe gear. Starting young, spacers, or avoiding it. Are they inherited? A lot of times they can be. The anatomy is there, but if you wear proper shoes with spacers and things like that, you can prevent it a lot of times. What's the downtime for surgical repair? Usually 6 to 8 weeks of recovery. If it's a bigger procedure, it's going to be about 2 months in a cast. Wearing high-heeled shoes, once again, you can wear high heels once you're better, if you like high heels. What's the time frame on recovery from bunion surgery? Once again, 6 to 8 weeks, possibly longer. Is there anything can be done for a second and third toe that are getting squished? So basically, if you have a really big bunion, the second and third toes, you can see here, get squished. Yes, but you have to fix the bunion. You can't just fix the toes. You have to fix the bunion as well. And any suggestions to addressing pain in the joint, but not from being in a shoe? If there's pain in the joint and not in the shoe, maybe a cortisone injection or an orthotic can be helpful. Okay, so I hope you found this helpful. This is just some information about bunions and a little overview of some help. Okay, thank you.